So I walk in and they go and grab the doctor immediately. And he's, oh, you need to come back to my office right now. And at this point, he's like, we're going to dissolve all of this out of your face. He was like, I'm worried about your eye. Are you having vision loss? I'm like, no vision loss, like nothing like that. But he was very concerned at the time. So he ended up dissolving the filler. And it took me probably about a month or two to completely go back to normal with my color.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Today, we're speaking with Haley Sullivan. Haley is a registered nurse here in Seattle. She had a vascular occlusion 4 years ago when she was a brand new nurse in another state, in another hospital, straight out of nursing school. She reached out to me wanting to share her experience because she realized only recently that she was embarrassed that this happened to her and she blamed herself. And she never even told her mom until this podcast was going to air. So I hope that hearing about her experience is really helpful in putting this in perspective and what it's like, even if you're a medical professional, to have a vascular occlusion. Hi, this is Dr. Kate D, and I'm here today speaking with Haley Sullivan. She is a registered nurse here in the Seattle area. She works in a local intensive care unit. And she has her own story of vascular occlusion that she wanted to share. So I'm really grateful that she's willing to come on today and talk about that experience. Hey, Haley, thanks so much for being here.
Yeah, thank you, Kate, so much for having me.
I heard about your experience through one of my staff members. How old are you now? And when did this event happen?
Yeah, so I'm now 26, and this event happened in 2020. So I was around 22 at the time.
Okay. So 4 years ago. And had you ever had filler before this happened?
No, I had never had any type of injection or really ever even been to a type of medi
Any place.
spa,
Well, you were
facial,
22.
nothing.
You were
Yeah,
22.
yeah.
I don't think you probably needed much, although I always recommend good skincare for everyone. But anyway, can you just tell the story from the beginning of what was going on and where this happened and how it all unfolded?
Sure. Yeah. I became a nurse in March of 2020, which was not the best time to become a nurse, but
My God.
yeah,
Yeah.
I was working in an ICU at a teaching hospital actually at the time, and some of the other nurses, I had been there since March at the time this happened in December of 2020, and I was speaking with some of the other nurses, and they were talking about how next week one of the plastic surgery residents is going to come onto the floor, and they usually give extra Botox or extra filler or just to practice or give it to the nurses for free. And that if anybody was interested, just to let them know. And that we were going to be doing that next week. So I was extremely excited because I feel like at the time, lip fillers were becoming like really big and all these things. So the only thing that I had an intention on doing was getting my lips done.
Okay. And had they done an event like this before that, or this was like brand new thing?
No, so this
Mm.
is not this was like a hush thing. Wasn't like a meet at noon to get this done. This is they're gonna be here around this time if you want anything. They're gonna be, injecting in the back or whatever.
Yeah.
So this was
And
kind of
then
like a
who's
hush hush
they?
thing.
Who is doing the injecting?
At the time, it was one of the chief residents of the plastic surgery team.
Okay. So this is
Yeah.
a chief resident, and plastic
Yes.
surgery is usually they do 2 years of general surgery and then they do 5 years of plastic. So this is literally at the very end of that. So he's
Yeah.
already, this was, I,
Yes.
resident? Okay. So he's
Yes.
already close to the end of his training. So he was pretty
Correct.
experienced, at least as far as surgery, right?
Correct.
Okay. And so you heard about it a week ahead. Were there a bunch of other nurses or other personnel that were interested in doing this?
Yeah, it seemed I think maybe 1 or 2 other nurses was gonna be doing it as well, but they weren't doing
Okay.
filler, they were just doing Botox, and they've done it multiple times with them, and,
Okay. So a
yeah,
couple other people had already had Botox, but not
right.
filler with him. And then, okay.
Yeah.
And so what happened?
So, the day comes and I go back there and they're like, "Okay, sit down. What all do you want done?" And I'm like, "Oh, I was just thinking getting my lips done." And they just start going. They're like, "Oh, we could do your Botox in your forehead. We could do your crow's feet in your eyes. We could do." I'm 22 at the time. I'm like, I didn't even think that these things were a problem. And he's
And
okay,
I
give
have
me
to interrupt here, and so
yeah,
the audience can't see you, but I can, and you have absolutely gorgeous skin with no
thank
wrinkles
you.
at all 4 years later, so just the fact that they're recommending these things for you when you're 22 is really something,
Yeah.
but okay, continue.
Yeah, and he's, "Oh, give me a big smile." He's, "Oh, wow, you have, like, very prominent smile lines." And I'm like, "I'm generally a pretty happy person," and I just never even thought that these things were an issue. I was like, "I just want my lips done. This is just for fun." And so I get my lips done, and he's, "We just wanna try a few other things if you're okay with it." He had another resident there with him that I don't think was as far along as him, if I can remember right. And I want to show him how to do this, all the things. Been a nurse for a while now. And I remember him injecting me. Eventually, he was like doing my smile lines. So the nasal,
The
maybe
nasolabial
fold.
folds,
Yeah.
yeah.
And he's normally, when we inject this area, we would aspirate back and make sure that we're not in a vessel or anything like that. But I know this anatomy pretty well. And so he's just injecting me like extremely fast. Now, knowing what I know now, I'm like, this did not take very long. And so he injects me, he does my lips, he does my folds, and then I ended up getting Botox in my forehead that same day as well. So I had a lot of work done. So I expected some bruising. I expected some things to come of the injections. I actually have like timestamps on my pictures that I took as the day progressed. So I think my first picture I took was like 7:08 a.m. And I got to work probably like 6:30. So this was pretty fast. And I immediately was just bruised up this left side of my face into like in the middle of my eyebrows. And I remember being in a good amount of pain and knowing what I knew as a nurse, I was like, I don't, there was this section right to the left of my nose that was just white and it had no cap refill. I was not getting any, I was pressing on it and no color was coming back to my face.
Right,
So I,
and just for our audience, we have done a couple previous episodes about vascular occlusion, but just as a reminder, cap refill is capillary refill where if you were to press on any part of your skin, it blanches, meaning it goes white because you're pressing the blood flow away from there, but when you let go, it should pink up right away. That's capillary refill. So
right.
that is what kind of goes away when you've got an occlusion. So you're a nurse and you're doing your own testing and you're
Yeah.
like, "Oh crap, I have no capillary refill."
Yeah.
Right? Okay.
And this was maybe 30 minutes after getting injected. I knew something was up.
So he didn't
And
recognize it at all. Is he long gone by this
they're
time
long
now or
gone. They're
okay.
long gone. Yes. And I didn't sit around. Nobody watched me for any amount of time. And then my next timestamp that I have on my phone, I'm sitting at the nurse's station and it's 11 o'clock a.m. So only 4 hours later. And it's drastically worse. My
Mm.
skin is just, my whole face is a bruise at this point. And I remember talking to the other nurses and they're like, "Oh, I feel like bruising is normal." And I'm like, "Okay, but to what extent? Because I can't walk around like this. People are going to think that I got hurt or something." And they're like, "Yeah, I would just like you would normally page about a patient and just be like, 'Can you come take a look at me?'" So I ended up paging the resident, the chief resident, and all I got back was bruising is normal. You're fine.
And just also, it can be quite difficult to tell bruising from an occlusion because occlusion causes a lot of times this mottled look that can look
Yeah.
like a bruise, and that's not clear. So he was basically brushing it off like it's probably just a bruise. I'm not even going to look at it.
Yeah. Yeah.
Okay.
Eventually, I took a picture of my face and I sent it to him, and I was like, "I need you to" this was probably, like, an hour later. I was like, "I need you to come by." At this point, I had looped in the attending
Mm,
of their service because I had other nurses that were very concerned and all these things. At this point, I don't know if they didn't have the dissolving injection at the
yeah, so
what is it called?
Hylenex or hyaluronidase.
Yeah, I think we
Yeah.
talked about that
Mm.
it's not always readily available,
Most
actually, at, like
hospitals don't store that, even in the ER. I think we've talked about this a couple times where if you go to the ER with a vascular occlusion, they'll call the person who injected you and say, "You gotta fix this because we don't have the equipment, we don't have
yeah.
Hylenex." And so did they was there any in the whole hospital?
I don't know. They didn't inject me again. They gave me nitro paste to put on my face. And I remember that he put it on me and I remember just this I couldn't handle it. It was one of the most painful things I've ever been through. And he was like, "You should leave this on for a while as long as you can." And I couldn't. And so I ended up taking the paste off. It was just burning so bad. And then I went home for the day and went by, and then I have another timestamp picture of me the next morning, and it's like a red mottled look, and I'm actually
Mhm.
had just gotten out of the shower, and the picture is like me crying, and I had sent it to my friend, and I was like, "I think this is an emergency at this point. I don't know what to do. I'm in so much pain." I'd actually called into work that day, and so my friend calls me and she says that she had gotten some work done and she's, "I know this really great plastic surgeon. I wonder if we should just go get a second opinion. Let me just see if we can go to the office. I feel like as soon as they see your face, they'll pull you back." So I walk in and they go and grab the doctor immediately from the reception area, and he's, "Oh, you need to come back to my office right now." And so he sits me down and he is looking at my face, and he's at this point, he's like, "We're gonna dissolve all of this out of your face." He was like, I'm worried about your eye." He was like, "The way that this is going in your face and all these things, there's concern of like vision." He's, "Are you having vision loss?" I'm like, "No vision loss, like nothing like that." But he was very concerned at the time. So ended up dissolving the filler, and it took me probably about a month or 2 to completely go back to normal with my color.
Just out of curiosity, when he was dissolving it, was he
Mhm.
able to get good capillary refill back at that point, or did it not change much with that attempt? Because you
I
can't always get it, right?
Yeah, I can't really remember.
After
I don't
was this
feel
one day
like
out?
it was one day out from being injected.
Mhm.
I don't really remember if we got immediate I feel like I got immediate relief, but I don't feel like my skin changed that much after he dissolved it out.
Okay. The relief from the pain got
Yeah,
better. Okay,
yeah.
so he at least, like, partially dissolved the filler from the inside of the artery. So when you put filler in an artery, one thing that's been very consistent with the stories that I've found from people who've had a vascular occlusion is that it's pretty painful. And whereas filler is not, when you get filler and it goes in the right place, it doesn't really hurt, and there's lidocaine in the filler, so it makes you numb. So if you just have a bruise and you're numb and it doesn't hurt, it's much less likely to be an occlusion if people are confused about that. But so that was really interesting. So they dissolved it and the pain got better, but the skin modeling stayed for a long time. Did
Yeah.
they offer any hyperbaric oxygen at all to help heal that?
No, I didn't get anything like that, done.
And so what's happening with the occlusion is that you're blocking the blood flow to the skin or to other parts. I had another person on the podcast a while back who lost not only half her nose, but like portions of her nasal passages inside her face were necrosed off, right? But once you restore blood flow, you're now getting oxygen and all the other things to your skin. And most of the time, if you restore blood flow, it should come back, right? But
Yeah.
hyperbaric oxygen is something that allows tissues to reox and heal faster. And sometimes I think heal when it wouldn't heal otherwise. Anyway. And the other thing about your story too is that nitro paste, they used to recommend as part of the protocol of an emergency treatment of an occlusion, but we don't really do that anymore. I'm not sure what year that became off the protocol. It turns out it doesn't actually help all that much. Did they give you an aspirin? Just curious.
I think maybe they did.
Yeah.
I I'm not 1,000% sure, it's all a blur, but I think maybe I did take an aspirin and then the nitro, which because I was like, "Is this a
Mhm.
heart attack? What's going on?" I feel like this is the exact treatment for somebody that's having chest pain, so it's just so
Yeah, with aspirin, with someone with a heart attack, they're having blockage of the vessel because of a blood clot, and aspirin will help make sure that there's no further clot and maybe try to help
yeah.
break down the clot. But with filler, obviously, it's not a blood clot, and the aspirin's not going to dissolve filler, but it will make sure that that blood clots don't form around the occlusions. That's always a good idea. So they treated it with the Hylenex the next day. It took, you said, just a month? After a month, did it look
Probably
normal
like
or
a month or 2 months. I do remember pretty heavily trying to cover it with makeup, but I eventually got back to normal, and now 4 years later, I can't tell at all. I remember a year later, if I looked very closely, I could see some discoloration, but I don't have anything left to this day,
Yeah,
so
thank
I'm
goodness.
very grateful for that, yeah.
Yeah, absolutely. And so what happened to this chief resident?
Yes, actually, this chief resident was using the plastic surgeon that I got a second opinion from, asked who did it to me. And I told him the name, and he said that that chief resident was actually shadowing him and using him for hours. I don't know how all the residency works, but I think he was, coming to his practice and using him as like an outpatient hours that he could use. A plastic surgeon actually kicked him off his service. I'm not sure if he still remains in the residency program. I remember the attending that saw me at the actual hospital was very upset with him, especially because I was written off 1, 2 times before the attending was even paged. The attending at the time was saying, "You should have called me immediately," when she was complaining of pain. And then and I even think that the attending was like, "Why are we even injecting
Right.
nurses? Like, what why was this?" The time I'm 22, I had just gotten this job. I trusted these people, like, everybody else was doing it. I just was being and I think we talked about this earlier, but I think a lot of the times when I tell this story, it's a lot of, "You're 22. Why are you getting work done? Why are you getting these fillers and injections?" And at the time, everybody was getting lip filler, and then I was pushed into this nasal labial fold filler. I didn't even think that it was an issue. I don't think
Yeah.
smile lines are an issue for me at this time. I don't think they ever will be because I'm never doing this again. So it's just too bad if I have smile lines in the future. But yeah, so I think that there was a lot of blaming on my part whenever I tell this story of that's so dumb. Why would you even do that? Or
So
why would you
people are
even
blaming
get
you for having this
right?
done at all. So I think,
Why would you let somebody train
yeah,
on you? But
that is a really, so that's a big component of why nothing's being done about this kind of thing, because people tend to blame the consumer, the person who was having it done, and they'll be told, "Oh, this was your choice. You went in there." This is really different. I mean, in a lot of ways, this was pretty coercive, because you wanted to get your lips done, which is not crazy. Okay. There are plenty of 20 somethings who want to get their lips done, and that can be done safely, but obviously anybody doing that would have to be able to treat an occlusion if it were to happen, right? And
right.
that, I think it's so important to make sure that whoever's doing filler on you is not only experienced, but is prepared to deal with the unusual case of a complication like that. It's just critical, right? So he's cajoled you into doing other things that you had no intention of doing that you didn't need. So he talked you into medical procedure you didn't need, which is really unconscionable. I'm curious though, where did he get the product from? Because he didn't buy it, right? So where is he getting that from? Did he have a full brand new syringe of filler for your lips, or was he using leftovers from patients or whatever?
God
Mm.
forbid, he's using leftovers. I don't know. They walk in with all this a briefcase of stuff. And I think that it's like the company sends them these
Samples or
samples.
something, yeah, and
And
you provide a lot of samples for learning and
yeah,
whatever, for
yeah,
sure.
and I think that these were samples, and I don't know if what they were doing was completely wrong, if they are given these samples and they're like, if this person's willing to let you practice on them, they're willing to let you practice on them. But another thing, looking back, I didn't sign anything. I was not told anything of any signs and symptoms. When you go to the doctor, they're like, signs and symptoms of you're having an adverse reaction to this vaccine, fever,
Right,
chills, sweating, all these things. I got nothing of that when it came to getting injected for the first time. And they knew this was my first time. So I had no idea. I was purely
right,
going off of nursing judgment and nursing judgment of less than a year. So I don't even know what I'm doing at this time
right.
either. So I'm a brand new nurse
And
time
I think
too.
it's really
So
important for everybody to know that what informed consent is. So, in medicine, legally, you cannot perform any procedure on a patient without informed consent. That is completely illegal to leave that out. Okay. And what informed consent is, we tell the patient exactly what the procedure is, how it's done, what the risks are, what the
mhm,
benefits are, and then also what the alternatives are. Like, if you don't have this procedure, what else could you do? Now, obviously, with cosmetic procedures, they're entirely elective, and the alternative is always you could do nothing, right?
right.
And I also think it's very important to know that even for any training session, for any modeling session where we're teaching, because we do this in my clinic with some frequency, right? We'll be learning a new procedure and we'll have models and they'll get the procedure for free, but we still go through the entire informed consent. As a matter of fact, during the training session, it's extra prolonged because we're talking about everything and we're getting it down for ourselves, like what this is all about and explaining it to the patient so they understand it. And for any model, whether it's, filler or for any other procedure, and actually for any appointment, for any procedure, we always go through the same full consent, even when we're doing it on a doctor or a nurse or other medical personnel who already know about the procedure. So I will always say, if I'm injecting a doc, I'm like, look, I know you know this, but I'm going to do my regular spiel anyway. And they
Yeah.
always will say, oh, absolutely. Tell me what you normally tell the patients because they want to know too. And obviously, as a nurse, you want that. So you had no informed consent. You were coerced into doing more than you really wanted. And then he wasn't prepared to treat an occlusion at
Mhm.
all. Did he ever talk to you or acknowledge what he did?
No, I was never reached out to. I don't know to this day where he is, what's going on with him. I do remember the attending being very upset, and I think from the way that she was talking to me was just, is there anything we can do? What can we do for you? All these things. And I was like, he could have done something
Right.
hours ago. And
Yeah.
I think this was more of a please don't take action for this. But from a nurse standpoint, I'm at the hospital that I'm working at the time.
Right.
I had no idea that it was going to turn into all these things. I don't want to get anybody's license removed for any reason. I'm hoping that from this experience that he takes this and uses it as listening to his patients, especially medical professional patients that probably know things, and not that non-medical people would. I feel like anybody would know, hey, something's wrong with me, but
Yeah.
especially a colleague of yours that you might have a rapport with, you might want to listen to them a little bit more.
Yeah.
um
Yeah,
so
absolutely. I think that you're lucky you've noticed it because in the case of the other patient, again, this was a previous episode called Disfigured Beauty, but she was not a medical person. She didn't recognize it until late that day when everything was closed and it was painful. It was this weird kind of burning, painful thing. And she wasn't treated for days, and I think
mhm,
that you're probably very lucky that it was treated within a day so
yeah.
that you were able to restore blood flow because you could have ended up with permanent scarring. The distribution where you describe is exactly the same as what she had, and it's yeah, and so the plastic surgeon, the chief resident, he was kicked off of that service, but did he graduate and he's a plastic surgeon out there? Probably.
I don't know. I don't know. I just know that he was not able to work any longer with
That
the plastic
one
surgeon that
attended.
dissolved my filler. Yeah, and the plastic surgeon that dissolved my filler, he was like, "This it's only a matter of time before an occlusion happens to he was like,
Yeah.
"It's only a matter of time before you hit a vessel." He said, and I'm not he was very great in explaining to me. He was like, "I'm not saying that it will never happen to anybody." I've never had an occlusion happen in my practice. He said, "But when if and when it does happen, you need to know how to treat it and you need to know when to listen to your patient." And it just so
Yeah.
happens 7 years into this chief resident's practice that he already had one. And he's honestly, what the plastic surgeon told me is he's lucky that it happened to me and not somebody that would take legal action against him, especially because I was not given informed consent. I wasn't told anything.
Yeah.
So I don't hold anything against him. I think the biggest thing for me was eye opening to, okay, we don't need to do things just because somebody else is coercing you into them. Because if you're going somewhere and it seems like they're trying to sell you a bunch of things, they probably
Yeah.
don't have your best interest. The med spa that I just went to that your colleague was at, I went in, I told her, I said, I just want to do true baby Botox. I still want movement in my face. I don't want to look frozen. And she listened to me, and we only did 10 units in my forehead and 5 in my lips, and I'm happy with it. And so that's the extent of it. I will never get filler again. I learned my
Yeah.
lesson for sure.
I mean, everything you just said is really true. So if ever a place is coaxing you to do something or saying, "Oh, you'll love it," and even if you're like, "Oh, I'm
Mm,
not really sure," just don't do it. Walk away. Don't even have the little thing because places like that don't really stop with that.
yeah.
And hopefully, like at Glow, we really emphasize just educating patients, meeting them where they are, making sure they understand all the risks. And for filler, we do filler. We're very conservative with it, but I am shocked at how many people have had filler elsewhere. And when they come in to my practice to have it, nobody has ever told them about the possibility of a vascular occlusion. And we always talk about it and say, this is what it is. It's very rare. We're prepared to treat it if it were to happen. But if it were to happen, this is all the stuff that would happen because it's not
Yeah.
so easy. It's many hours of treatment that you go through. And we went 10 years before we had an occlusion ever. And it was recognized immediately by my colleague and then immediately treated. And everything was fine. It was really lights your heart on fire. It really happens to you. You just have to be prepared for that. So I think the most important thing is one, don't have anything done if someone's trying to talk you into it. And two, make sure you have a signed consent form. If you have a consent form, read it and make sure you've talked about all the things in it with the provider. And if you have questions, ask questions. In my place, we have people sign a consent form every single time they have the procedure. If they've had it many times before, they're like, ah, yeah, whatever, I know about it. And I'm okay with that as long as we've talked about it in full, at least the first time. But I think that's really important. And then always make
Yep.
sure that the provider you're going to is licensed and doing it legally. And I know I've gone through all of that many times before, but always look their license up, look up who the medical director is, and ask to make an appointment with that medical director. Because if that medical director is an absentee person and is not ever there and is not actually medically directing, then you won't be able to get an appointment with them ever. So that's the way to know if it's possible or not. So I know that you're never gonna do filler again, which, is totally fine. I'm old, I'm 56, I have no filler in my face. I think that's totally reasonable. If you take care of your skin, you're good to go. And is there anything else that you wanna any piece of advice for our listeners or anything that you would add now that you've had 4 years since this event perspective?
Yeah, so I was going to add to the consent thing. As a nurse, a lot of times before a doctor even walks into the room to get consent for a procedure, I take it into my practice now. Okay, can you explain to me you understand that we're going to do to you? And can you explain from your own understanding before this doctor comes and talks to you the risks of what could happen? And the teach back method, I think, is great. And this is just when they explain everything that they believe is going to happen and all the risks that could happen. And I think that's what I've taken into practice now. And I share my story and I tell people all the time, and all these young girls getting all these things done. I'm like, please, just because they're having, oh, two half a syringe each for you and your friend. You split a syringe with you and your friend for $500. Please be careful with things like that. There is a reason why they have these crazy sales. Just know where you're going, know who you're seeing, and read reviews and read stories. Listen to these podcasts. Don't go through things just because everybody else is doing it.
Yeah, I think that's a great point. If you've got like access to a super screaming deal that seems too good to be true, it
Yeah.
probably is. There's got to be a catch. Maybe they're practicing on you and they've never done it before. Like I would be very cautious with stuff like that.
Mhm.
And I'm going to say one more time, don't ever do a Groupon because that is just there's no real medicine that could be done on properly on Groupon. It just Groupon takes so much of what you're charging and it's so cheap. It can't be real. It can't be I just don't do it. Yeah. Anyway, Haley, I'm so grateful that you are in the ICU and that you're taking care of patients. I so appreciate your being here today. So thanks for sharing your story.
Yeah, thank you so much for having me. I really appreciate it.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website medspamayhem.com. And read the book. Medspa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.